All right, good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Tonight I'm doing my first talk on peripheral neuropathy. I smile because I started doing this actually about a year ago, and I have a new purpose. My purpose is to bring you some really good content that you can talk to your doctors about. So for those of you who have neuropathy, who have questions about neuropathy, I'm looking to answer all of those questions this year as best as I can, and to give you palatable information that you can understand that will facilitate really good conversations with you and your local neurologist. So that's the intention of this new series. Today is video 1, and we're going to be going through kind of an overview of peripheral neuropathy. Maybe it will provide some clarity as to why a lot of you are told that you have idiopathic peripheral neuropathy and quote unquote, there's nothing we can do for you, and half of you have diabetes, the other half we don't really know. I'm going to try to give you both perspectives. At the end, I'm also going to loop in some information regarding what neurologists are facing in the world of peripheral neuropathy, and maybe that will help you to have greater compassion for your doctor and some of the strains they are underneath. Okay, so without further ado, let me see here. I'm going to show this in screen. We're going to do the other way around. Okay, so this is a seminal article. I've talked about it before regarding the diagnosis and management of peripheral neuropathy by neurologists. This was published in JAMA Neurology. JAMA is the Journal of the American Medical Association. It is one of the highest impact journals out there. So when something comes out in JAMA, doctors tend to pay attention to it. And there are different subdivisions of the journal JAMA. This is the neurology division. So this came out in 2014, and the title of the article was "The Role of Neurologists in Diagnostic Tests in the Management of Distal Symmetric Polyneuropathy." Distal symmetric polyneuropathy means peripheral neuropathy to you. Peripheral neuropathy is actually a wide umbrella, technically, in the doctor world. Something like carpal tunnel syndrome is a mononeuropathy or a form of peripheral neuropathy. But when you use the term peripheral neuropathy, we're talking about individuals who tend to have numbness or tingling or burning pain in their feet. You may have weakness in your legs. It may spread up to involve your hands. And with that, we call that peripheral neuropathy, but the technical term is distal symmetric polyneuropathy. So you as the patient, and I'll probably have better graphics in coming weeks, want to think of the world of peripheral neuropathy as a pie chart. About half of the pie chart in terms of causation of the neuropathy is diabetes. Unfortunately, diabetes is being seen in about 10% of the population, and it's only going up. We now know that 1/3 of our population is overweight, 1/3 of our population has prediabetes, and another 1/3 is clinically obese. And it's thought that prediabetes is going to become even more common, and diabetes is going to account for more than 10% of the population. So we have some huge looming health issues societally, but we can get into that later. Just know that diabetes is becoming more common, and as it does, we're going to see more and more cases of peripheral neuropathy. The other half of the pie chart, we're going to want to think about 1/3 of that other half of the pie is accounted for by prediabetes. So prediabetes is this condition which can be going on for 10 to 20 years before a person becomes diabetic, and we're actually finding that prediabetes is a major cause of peripheral neuropathy. Although the standard blood test that your doctor does, like a fasting glucose or even a hemoglobin A1C, is not great at diagnosing prediabetes for neuropathy patients. And that's something that I really want you to pay attention to in coming weeks, because I'll talk about certain lab tests which may have an interpretation in standard medical or clinical practice, but there's actually a certain way to interpret some of these tests from a neurology standpoint. So I'll try to give you some information on that. About another third of this other half of the pie chart is due to gluten sensitivity. Very, very important. So gluten sensitivity is a big deal in the neuropathy world. And then the remaining third, we have like a myriad of literally 80 to 100 different causes. Some are let me say it this way. Some can involve your bone marrow. If you have liver or kidney failure, that can be important. Certainly the B vitamin deficiencies, which all of you seem to pay particular attention to, thinking that if you take B vitamins, it will help your neuropathy. Sometimes it will, but oftentimes it won't. Overdoses in B vitamins can cause neuropathy. Alcoholism can cause peripheral neuropathy. We have a whole world of genetic neuropathies, and then we have these other forms of immune neuropathies like Guillain-Barré syndrome and all the different manifestations thereof. So neuropathy is a big, big topic, and I'm going to try and take it piece by piece in detail. I would love your feedback, and I'm going to try and basically talk about this for about an entire year unless I get through it faster, but I really want to do it justice. And good evening to everybody who's joining, by the way. So that's the overview on peripheral neuropathy. Now I'm going to go through some segments of this article. Let me see here, am I going the right direction? Okay. Now I'm going to comment that this article was written by some individuals who had some disclosures. One of the disclosures was that the doctor worked for a group who brought things to the FDA. So one might surmise that there was some, were they trying to influence policy? I don't know, but that's just something that I noted, and I think it's important to take into account because there are always two sides to a story. So I'm going to try and provide you with both sides, or actually maybe even three sides in this. So let me read you some excerpts of this article. In the introduction, they go on to say that the outpatient costs for evaluating neuropathy patients is about $357 million a year. So it's about a third of $1 billion goes into providing services for diagnosing peripheral neuropathy. Now, with that diagnostic workup, the two sides are that you as the patient are going in and you want your problem to be figured out, of course. And so you want lab tests run, you want imaging performed, you want electrodiagnostic testing performed, which is where they stick needles into your muscles or, zap you with electricity to see how fast your nerves are firing. And that creates the complete workup. Unfortunately, I see a lot of patients, and maybe those are just the ones coming to me who are disgruntled, but a lot of patients come in saying, I went and I saw my doctor. They told me I have peripheral neuropathy. There's not much they can do for it. That may be the explanation. And as I titled this presentation, let me see if I can keep going through the titles. Peripheral neuropathy, why neurologists are limited on testing. What you need to know as the patient is that your doctor may not be able to provide you with the tests because they might be constrained by what insurance is allowing them to do or not to do. So that's so important. So if you have gone and seen your doctor and you say, okay, I have peripheral neuropathy, or I'm having numbness, tingling, and burning in my feet, and I'm suffering with these symptoms, and you don't feel like your doctor is hearing you, or you don't feel that your doctor is doing enough testing, it may be that they just are literally constrained by the insurance companies and not allowed to do a full battery of tests. And so, again, my intention with this discussion is to give you tools to talk to your doctor, to understand your doctor and where they're coming from. So you can say, hey, I'm really curious about, do I have prediabetes? Or I'm really, I did drink in excess for a few years. I didn't tell you about it, as an example. And so can we test my thiamine or my vitamin B1? Hopefully with this will create better communication between you and your neurologist. So nonetheless, I digress. As I was saying, neuropathy costs are around $357 million a year in 2014. And they basically said in this article that electrodiagnostic testing, where a doctor does EMG testing, nerve conduction velocity testing with you neuropathy patients, which lots of times becomes the gold standard for validating if you have neuropathy or if you have something else, that ran about 205 million out of that 357 million. And then they're saying the MRI is accounted for 135 million. The numbers don't quite add up as I see them, but in essence, the vast majority of costs for evaluating peripheral neuropathy were spent by insurance companies on paying neurologists to do electrodiagnostic tests and MRI tests. You, from the patient standpoint, probably have a vested interest that you want your problem to be figured out. From the neurologist standpoint, they have the obligation and the fiduciary requirement to figure out your problem and to make sure that they're accurate and to make sure that there's not something else causing your feet to burn or tingle or be weak. The world of neurology is very complicated, and neurology was considered almost an art form before the advent of MRI scanning and CT scanning. Since we now have the widespread use of these imaging modalities, as they say here, in the introduction, they said, not all primary care physicians see the benefit of having a neurologist involved in the diagnosis and treatment of common neurological diseases such as TIA, dementia, and Parkinson's disease. So there's this notion in the medical world that, you know, what is the role of a neurologist? Because your general practitioner can order an MRI in your back. Your general practitioner can order an MRI in your brain. Your general practitioner can run these blood tests. So what is the role of the neurologist? And I'm trying to, again, provide the many standpoints for you. So you're the patient, you have neuropathy, you want an accurate diagnosis. It's the job of your neurologist to provide that accurate diagnosis. And I think that's really, really important. Neurologists need to have the ability to order an MRI on you if they think it's your neck, because the neck, stenosis in your neck is actually a really common cause of tingling in the feet. So they need that ability. They need that ability to order the electrodiagnostic testing on you. Unfortunately, in this article, their primary conclusion, let me see if I can scroll to that. I'm going backwards, sorry. Their conclusion was that prior to diagnostic testing, meaning electrodiagnostic testing or MRI scanning, neurologists were able to determine the cause of neuropathy in about 2/3 of these newly diagnosed neuropathy patients. And after the diagnostic testing, they identified another 15% of cases. So their general point was basically that neurologists are wasting money by ordering all of these diagnostic tests, and really with a few cheap lab tests looking at thyroid function, B12, and blood sugar function, your neurologist should be able to figure out the cause of your problem. And basically the role of the neurologist was then to alter your pain medications, and that's where they're really important. My qualm with this research study is that it seems to be a general trend in healthcare to constrict doctors down into a tighter window of what they can and cannot do. And it seems to promote more and more dissatisfied patients who then are almost angry at their doctors, but you shouldn't be angry at your doctor, you should be angry at the system, if that makes sense. I hope this is all coming together. So, and again, good evening to everyone who's joining. So with this all being said, what is the point? The point from the patient standpoint is that you need to understand that neuropathy is complicated. You need to understand that symptoms of peripheral neuropathy can come from your lower back. They can come from your neck. They can even come from your brain. And neuropathy patients, in my opinion, and a lot of neurologists in the medical profession would assert this, me being a board-certified chiropractic neurologist, referred to as functional neurology, basically the diagnosis is all the same, but a lot of medical professionals would assert that you need a thorough workup. You need a thorough diagnostic workup. There's an immense amount of skill, years of study that goes into understanding how your brain, your spinal cord, or your peripheral nerves can create numbness or tingling or burning in your feet. And you want that done in the hands of someone who's really well experienced and really qualified, such as someone qualified in some domain of neurology. And so that's important. And then hopefully with this discussion, even though your doctor may be constrained to a certain degree, you can say, hey, well, what about gluten? Since we ruled out diabetes and prediabetes, what about gluten? I was reading about gluten being a common cause of peripheral neuropathy. Or, hey, you know, my liver was giving me trouble back in 2015, and can we investigate that a little bit further? Hopefully you're going to have these tools to have these discussions with your doctor. So that's really the intention of today's broadcast. It's an overview. I'm going to keep hammering a few points on basically the complexity of peripheral neuropathy, but also nuances that may apply to your specific history, and then facilitating discussion, and so you can also better understand where your doctors are coming from. You also need to understand that within the world of healthcare, doctors are paid for doing diagnostic testing. So your neurologist lots of times is keeping the doors open by doing electrodiagnostic testing. It's not only a way for them to support their practice, but it's also a way for them to actually accurately diagnose your condition. And I disagree with some of the assertions made in this article. That's just my opinion. But I've seen electrodiagnostic testing be very valuable. While I will also say that a good thorough neurological exam, yes, can accurately identify a lot of peripheral neuropathy cases. And also a good thorough neurological exam is really important, because I can't tell you the number of patients who have come to me for peripheral neuropathy, and it turns out they had stenosis in their back or their neck. So let's try and get away from cookbook healthcare and get back to patient-specific healthcare. I think that's more important in the world of neuropathy than ever. And send me your thoughts, your feedback, and we'll go from there. So I'll be back next week with a talk on neuropathy. Tomorrow night's talk, I think, is on vestibular migraines. I believe tomorrow night is vestibular migraine. It's some other neurologically based talk, and it may be on autoimmune disease. We will be talking about vestibular migraines this week in another general discussion. So have a good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist and chiropractic physician, signing off.